or um, let us know in the chat who you are. Okay, so I think most of you probably know who we are at OPQIC. Here is our official slide of our small but mighty team, and always want to thank my team for being so awesome. So I'm going to go into a couple of reasons, like I said, about why we're doing this program and why.
Too loud for you.
No.
Okay.
Why we started. If everyone can please make sure you're muted before we continue. Wanted to make sure that all of you all understand why we're doing this and why we even developed this program. So first of all, as we look at our state maternal mortality review report, if you'll go to the next slide. You all, I hope, are familiar with this. This is released in the fall every year, and these we have seen year after year, if you go to the next slide, recommendations as to the population and their families and patients needing to be educated on when there is a problem and how they should seek help. Many times we have patients that did not go to seek help. For example, they were having a terrible headache and did not go to the hospital, did not call their provider, and they had a stroke. So those are things that we see, or other things you'll see with the warning signs and our just our resources that we want to share that are there for them if they are not having an urgent problem or emergent problem, but need to find a credible place to go. So these are recommendations from the Maternal Mortality Review Committee. We also want to highlight the CDC Hear Her campaign. If we'll go to the next slide. This was released in 2020 because from the state maternal mortality review committees, we are not the only state that saw that issue. That number one, patients were not knowing when to seek help. They didn't know how to seek help, and also that they voiced concerns, but they were being dismissed. So it's not only a matter of the patients feeling empowered to voice their concerns, but also that we as clinicians are listening to them and that we investigate and we don't ever blow things off like, oh, I'm sure you're just tired, and that we educate their family to not blow them off, to pay attention to these different changes that they know best in their body, and to support someone to come in and seek the help that we need, that they desire, and that we need to listen to them to investigate their concerns. So if you look at this website here, if you just Google CDC Hear Her campaign, there are many resources that they have. If you go to the next slide, you can see different resources they have. They have lots of tools that they have. They have different videos. We have someone in Oklahoma that's featured on a video about perinatal depression. We have, there's different types of patients that have resources and videos. So I would encourage you to examine this to find your own resources that you can share with your patients. Many of you all remember Sarah Johnson, who was our patient that was on our staff, our patient partner, who had a traumatic birth and, had voice concerns during her labor, during postpartum, after she went home, and she was her concerns were not appreciated and not investigated. And even, early on during her pregnancy with questions that was not investigated, and probably her whole trajectory of what had happened could have been prevented if when she had a ultrasound during her second trimester, if that would have been um, listened to and investigated, and they could have, we anticipate, found something that was concerning and would have prevented everything that would have happened. So Sarah and her team of patient partners developed this whole patient empowering pregnant and postpartum patients toolkit. And we would like for all of our hospitals and clinicians in Oklahoma to be utilizing it so that we no longer see these times that people did not come and seek help, and all of our patients leave empowered to feel that they know when to seek help and how to seek help. So if you go to the next slide, I also want to, when we talk about listening to women, that if you'll click through a couple of times, Melissa, that, it's important for us to provide this judgment-free care and individualized care. So think not listening to little voices in our head. Well, there's probably nothing wrong. Maybe this person is seeking drugs. Maybe that's what you find out is going on, but they deserve to have their concerns investigated. Everyone deserves to have concerns paid attention to and investigated, and also that we are providing the individualized care that each person deserves as well. So going to the next slide, just want to emphasize our website, and this is where you will find
You're going into crazy.
Find the toolkit that we have on our website that we're going to go over today. And I am going to turn it over to Evelyn Radishell, who will get more in depth about the toolkit.
Thank you, Barbara. Good morning, everyone, or I guess good afternoon on this rainy day. Hope everybody is staying dry right now. So as Barbara mentioned, the toolkit is located within our website, and hopefully you all have that bookmarked in your Google or whatever driver you use. But there's a couple different ways that you can get to the resources. So on this page that you're looking at right now is the across the top of the main page, we have resources for professionals. So you can click on that link, and then you can see where it has the Empowering Pregnant and Postpartum Patient Toolkit. On the next slide is the link for resources for families and patients. You can also get to it through that link as well. We also have the individualized pages that we're going to go over listed there so that you can click on those and print them as posters, etc., flyers for your patients in your hospitals and clinics. So if we go to the next slide, this is the actual table of contents for the toolkit. It is in what's called the live binder, and so it stays updated. We can see how many people are viewing this and utilizing it, and so we're going to walk through each of these elements that are listed here on the table of contents, but just so you kind of have an idea of what is included in the toolkit itself. So the first thing that we're going to talk about is the overview. So this kind of gives you an overview if you're training other staff. It's a 6-page implementation guide that'll walk you through how to use each of the items. Kind of talks through, this screenshot here is the first page of the guide. However, each one of these is explained in more detail on how to utilize them. And we're going to talk through that here in just a minute. But I just wanted to make sure you knew that you had this part available. So if you are adding it to training, which I feel like would be really important for new staff, if you have like a onboarding process, maybe adding this to that process for new staff. And as you're training your current staff on this toolkit, you can utilize this implementation guide. So the first thing I want to kind of start with is the urgent maternal warning signs. This is a great resource to be given prenatally. It does come from the AIM website. It's a simplified poster to show what signs and symptoms to look for during pregnancy that might alert the patient to something that's going on. Currently on the live binder in the toolkit, we have this listed in 4 different languages, so that are common to the Oklahoma area that we've had requests from. So let us know if there's any that you're interested in that aren't listed there, and we'll see if we can find a translated version for you. But again, this could be hung in triage areas, clinic, patient rooms, handed out in packets that are given prenatally, anything that's going to help the patient understand what to be watching for during their pregnancy. The next tool that we're going to look at is and Barbara and team, feel free to jump in at any time if I'm forgetting anything, is the post-birth warning signs. I know a lot of you are already currently using this, giving it out in some fashion, either in paper version, in a booklet, or as a magnet, and that's fabulous. And please continue to do that. We need to educate our families and patients on this, especially the family members, because they need to know to look for this. If there's something going on, it should be on their refrigerator. They have updated this tool recently. A1 has updated it, and so we do have the most current version now as part of the toolkit. But also, so you know, we have it in Spanish and English on our site, but it does come in 50 different languages. So if you're needing a special language, you can get that from the A1 website. But A1 does offer magnets as well for sale. I'm at a discounted rate if you buy them in bulk, or you can create them through your own hospital marketing department. I know some of you have already done that. But again, just making sure to educate the families so that if they were to call 911 because at home something has occurred, they need to make sure to remind the paramedics, the emergency department, that this patient has recently been pregnant, and potentially if there were any other issues going on when they were discharged from the hospital. Maybe they're on blood pressure medication because they have had some issues with preeclampsia or any history of hemorrhage, etc. So be sure to keep this handy, encourage the patients to keep them handy at home. Next, yeah, go ahead, Barbara.
Before we move on, Melissa, can you go back to the post-birth warning signs? I do want to add that for both the urgent maternal warning signs and the post-birth warning signs, that it's important, particularly if a provider is giving this information during pregnancy with the urgent maternal warning signs, that they educate. We would, and this is in the binder as well, as to how to utilize each of these tools. But we want these warning signs to be explained to them, and also, not just given a handout that you're hoping they'll look at. The other thing is that you tell them, how do you want them to get a hold of you? So I see Amy Vasco on. If Amy is talking to one of her patients prenatally as a midwife, then she would say, okay, if you experience any of these, these signs, I want you to call 911. But if you are having a question, or you have some bleeding, you have these other signs that you may not need to call 911, but I want you to call my office on weekdays. On the weekends, you call this number, or you go to the hospital. So what do you want your patients to do if they experience these warning signs? So there is no question, because I know I've been there. You guys probably have all been there too, that sometimes we're like, well, what should we do? Should we call the doctor? Should we just go in? And it's a hassle when you've got a newborn, particularly, and you're having to go into the hospital. So make sure that you explain what you want them to do and that you give them permission and really emphasize, I want you to call if you are have any questions, if you feel any of these things, I want you to call. Please call. So give them that permission to call, and so that I want you to pay attention to these things. So if you experience them, don't blow them off. I want you to call, and so that we can have a conversation, or that you can be seen, or whatever you want. So please, those are some key pieces of this that you make sure that you emphasize with your patients.
Barbara, I can add to that a little bit if you want.
Sure, go ahead, Amy.
Particularly because I see patients just prenatally. I mean, I do see them postnatally, but not till 2 or 4 weeks later. But I do give them the maternal warning signs in my little handouts that I give. And that is always one of the first ones I go over. And I talk about that. This is a refrigerator flyer. Put it on your refrigerator so your whole family can see it. These at least warrant a phone call. It's whether it's to me or if it's the middle of the night. It could also mean go to the ER, but it warrants a phone call at minimum.
I think that's a good way to say it, Amy. And also, they can bring this. I know that we've had at least one hospital that put their post-birth warning signs in a red envelope so that they're easily seen. And that hospital had a patient come in, and the mother had that in the envelope and was showing the emergency department and said, yeah, this said for us to come in. This is why we are here. And it really validates to the emergency department staff that hopefully we're going to be able to educate them too. But you may come across one that may not be appreciating the seriousness of this. So yeah, bring it in with you and put it in the red envelope. I think that's another good idea to make sure that it's noticeable after they go home.
Thank you, Barbara. And I just was going to mention too, as well as you kind of mentioned about the emergency departments. In our OPS classes, I know that they do train on this flyer. And so hoping to educate more and more of our emergency departments across the state about the flyer and the incidences of things that are happening with our pregnant and postpartum women. And so I know Katie is working on a workshop that's going to be happening this Friday, and another one, I believe, in a couple weeks. So hopefully more and more of our emergency departments will be alerted to these warning signs and understand the importance of getting our patients treated quickly. So moving on to our next document, this is the birth hospital clinical summary. And I know a lot of you have already been using some of the LiveBinder toolkit. We understand that this particular document was one that was a little bit challenging to be able to use in the hospital, but I want to explain a little bit about that. And first of all, this tool was created by our patient partners that Sarah had worked with. And, all of them had some kind of traumatic experience in the hospital. And so a lot of times what happens is they go home and they, after delivery, and they have an event at home, and then they get taken to a hospital that maybe wasn't the hospital they delivered at. And so having information available for that hospital when they may not be able to get it very quickly is very important. So that's where this kind of tool came in production, was because of those types of things. So either you can have this printed as part of your EMR discharge paperwork so that it can be filled in for the patient, or you can just hand it to the patient and then help fill in the gaps for them before their discharge. But understanding the importance of why this tool is here is really, again, like I said, for them when they're coming back to the hospital, because they may or may not be going to the hospital that they delivered at. So for instance, if they ended up at delivery time having a hemorrhage, or they had a surgery, or they had to get blood, those types of things are listed on here. And so that when they return via IMSA, because they've, hemorrhaged at home and they're passed out or whatever, then the family member can bring this. If the emergency department or the new hospital is asking questions, the family member then, or the patient, would have the information readily available to say, here's what happened at delivery. So that was, again, the importance of this particular tool and why we have it. And so if there's any way you can work this into your discharge process, I think it would be greatly appreciated. If nothing else, just having it printed for the patient to fill in themselves and get while it's still fresh in their mind. Any other comments about that, Barbara? Or okay, we'll move on.
I'll just add, Evelyn, that the hospital that we mentioned earlier that has utilized the red envelope system, it included that clinical information sheet in there. And we've already heard testimony from a couple of patients from that hospital that their family members used that sheet, taking in one of, a mother who needed help but was unresponsive and unable to answer questions herself. The family just handed them the envelope and they were able to kind of get the answers from that sheet. So, that was our intent, was that hopefully it would be helpful at some point, and we're already hearing stories that it is.
Thank you, Denise, for sharing that.
Yeah, and I'll just add that, often the barrier is a legal barrier because they say, is determining, is this a part of the medical record, things like that. So even taking notes on their phone or whatever that can explain, sitting down and explaining to someone what happened while they gave birth, and it should even be for all births, this information. A lot of people, it's like, well, did you have any tears or an episiotomy? I don't know. They don't know anything. We had one patient that had a hemorrhage, and then she had to be resuscitated. She was in an ambulance and she had hemorrhaged at home. And her husband, he didn't know anything because they had not explained anything to them about what had happened. So it's really important to at least describe to them what happened so they have the knowledge. If you can give them something written, we know that people are getting big packets of their diagnoses and everything like they're required to, but that's often a big thing that's not easily reviewed and is not helpful in an emergency. So this is, again, something you can put on the refrigerator to have available if you need it.
Thanks, Barbara. So our next tool in the toolkit is our helpful information page. And as it says at the very top, place on your refrigerator along with post-birth warning signs. So there you go. Definitely, we want to make sure that we're talking with our patients about these things, encouraging them to have them readily available at home. But this page is kind of combines some of the other resources that we know we might need to refer to all in one spot. So we've got mental health information with the new TLC Mama information. We've got the fourth trimester project websites, breastfeeding information, so helpful. And when you're in the moment of crisis in the middle of the night with a baby who's not feeding well and something's going wrong, the last thing they want to do is try and search for a number. So having this handy and readily available on the refrigerator again, or somewhere else that they keep that information, is good to have. And then obviously our medical emergency numbers at the bottom. And then the QR code is a link to the toolkit and the patient support. So if they have any other questions about things, it will it will take them there. So we want to make sure that, they have everything they need, because it is so overwhelming after giving birth. We're in a fog of postpartum fog. And so, and we also know that people are afraid to ask for help and they don't want to seem like a failure. So we want to make sure that they understand that it's okay to call and not to hesitate. And then the last page, next slide, that we have here. This is in the toolkit as well. This is a helpful poster that can be placed in emergency rooms or urgent care clinics. This comes from ACOG, and in our toolkit, it is listed in English and in Spanish. I think also a couple black and white versions as well. But again, just letting healthcare teams know and reminding them that you have been pregnant in the last 12 months. And so we want to make sure that we're taking care of you in the proper way. And I know Barbara can speak from experience being on the MMRC review board, that there are so many things that can occur up to 12 months. And we know that our rates of morbidity and mortality postpartum are increasing. So again, very important to educate our emergency teams. And so please encourage them to attend our workshops for OPS, as well as just sharing this general information with them. And are there any questions about this part of our so far? Any questions about the toolkit, where to find it, how to use it? Okay, well, I'm going to turn it over to Denise. If there are no questions, she is going to go over how this toolkit is related to our spotlight criteria and more. Thank you.
So just recently, and we sent out an email this week with an attachment to our 2025 Spotlight Hospital Award criteria. So these are the awards that we will be recognizing hospitals with at our annual summit. And we now have an official date for our summit this year. It will be on Tuesday, November 18th. We do plan to have the summit at the Oklahoma City Convention Center, so go ahead and save that date if you have not already done so. Registration will open up probably late summer. But we will be assessing this criteria on September 30th of 2025, so this year. And we're mentioning it today because the utilization of the EPPP toolkit is one of our criteria. So specifically, what we're looking at recognizing is distribution of the post-birth warning signs handout and distribution of the helpful information handout. And we will be asking hospitals to report to us. We'll be sending out a form sometime in September where you can let us know the percentage of patients that you believe are receiving either of these two handouts. And so greater than 90% is our goal for each one. And we will be awarding 1 point for each of those practices. Again, I also didn't mention that we will be awarding on a tiered system this year, just like we did for 2024. So we are going to be having a gold, silver, and bronze level achievements. And so the other criteria that we're going to be looking at to assess for the award includes the perinatal measures. This year, we're looking at PCO2, which is cesarean birth, and PCO7, which is severe obstetric complications. These were optional to be reported for 2023, but they were required to be reported to CMS by birthing hospitals in 2024. We don't currently have those data that are available to us yet to report, but we do anticipate it will be available before our September 30th deadline. So we don't have an actual rate for PCO7, which is the severe obstetric complications, to be able to say what we're going to award, but we are just going to use the national average for that time period as our point of reference. So giving points to hospitals whose SOC rate is below the national average. And just a little bit about SOC, it is a little bit different than severe maternal morbidity in that it also includes mortality and patients who are discharged at death in the hospital. It's a risk adjusted measure. You can find more information about it on the Joint Commission's website. And for PCO2, the cesarean birth, that's basically your NTSB rate. And we're using our Healthy People 2030 goal as our standard for getting 3 points. So if you're at or below the rate of 23.6, you'll receive 3 points. And then greater than or equal to 30%, you will receive no points. And then we have 2 midpoints in the way. They're in between 30% and the Healthy People 2030 goal. These are actually reported to CMS. So we know that each hospital who receives funding from Medicare, Medicaid, which should be all of our birthing hospitals, are required to report these rates. So your hospital will have these rates, and we'll be asking for you to submit these to us. Another CMS reported criteria is the birthing friendly designation. So we are awarding 2 points to every hospital that is designated as being birthing friendly. And the criteria you can see here is that you participate in a statewide or national perinatal quality improvement collaborative program like OPQIC, and that you implement evidence-based care practices to enhance maternal health outcomes. We do anticipate that all of our birthing hospitals should meet this criteria by September 30th. Regarding breastfeeding, we are giving points for hospitals who are baby-friendly designated. So those hospitals will receive 3 points. Hospitals that are on the baby-friendly pathway or are participating in OBRC's Aim High initiative, meaning that they are in the process of trying to achieve baby-friendly designation, will receive 2 points. And then for hospitals who aren't on the pathway, we do evaluate your NPINK scores. And we know that we have the state report, which is available currently. The hospital reports should be coming out very soon. So we will have your 2024 NPINK score that we'll be able to utilize to assess this criteria. And so those hospitals that have an NPINK score greater than 90 will receive 2 points. And then hospitals that have a score above the Oklahoma average but less than 90 will receive 1 point. For infant safe sleep, we're recognizing hospitals that are certified with the Cribs for Kids Safe Sleep Certification Program. They have their 3 levels of certification, so we're assigning our points accordingly to hospitals that are certified at either the gold, silver, or bronze level. OK Mama is our initiative that we hope to be launching very soon. OK Mama stands for the Oklahoma Maternal Addiction and Mental Health Assistance. And this is going to be replacing what we've previously been operating through Omno. So it is different from Omno in that it includes substances other than opioids, and we're also adding in mental health assistance as well. And so we have been sending out surveys. If you are one that has received a request to complete that survey, but have not yet done so, here we are urging you to please complete that survey so that we can have our pre-implementation data in place. So if you don't know what we're talking about, we can let you know whether or not your hospital has completed that survey. But starting later in the summer, we hope to start our very first sprint, which will focus on screening for both substance use disorder and mental health screening. So committing to the sprint, if we haven't started it yet, hospitals can achieve 1 point. If we're fully into our sprint, it will be participating hospitals that will receive 2 points. With Teen Birth, we certainly want to recognize hospitals that have achieved Teen Birth recognition. So those hospitals will receive 3 points. Hospitals who have applied for recognition prior to September 30th will receive 2 points. And then hospitals that fully implemented Teen Birth after September 30th they would not yet be eligible for recognition application. You have to be implementing Team Birth for at least a year before you can apply. So we know those hospitals that are fully implemented but not yet eligible to apply would also receive 2 points. And then hospitals who have fully implemented but are eligible but have not yet applied will receive 1 point. We are also recognizing hospitals that are certified with perinatal care certification through the Joint Commission. They do have their advanced perinatal care certification that is eligible for all birthing hospitals. Hospitals do not have to be accredited by the Joint Commission to be able to apply for this certification. It is a pretty extensive process where we know that you have to put in lots of efforts for reporting on the measures and then also elements of implementation in place. So we do want to recognize hospitals that have gone through that process. And then also, finally, we want to recognize hospitals that are highly performing with their newborn screening processes. So the two things that we are looking at are transit time. So are you getting your specimens to the laboratory for analysis within 48 hours of collecting them? We know that a lot of the conditions that we're screening for are highly time sensitive, and so getting them to the laboratory in a timely manner is very important in the process. So hospitals that have more than 95% of their specimens that are arriving within that target time frame will receive 3 points. Hospitals that have between 90 to 95% of their specimens arriving then will receive 2 points. And then not only do we want the lab to receive the specimens, but we want the specimen to be eligible to be analyzed. And so we typically refer to that as an unsat rate. And so that's the percentage of specimens that the lab determines are unsatisfactory for testing. So a lot of this is during the collection process specifically. The rate that we're looking for is less than 2% of the specimens are unsatisfactory, meaning that more than 98% of the specimens your hospital sends can be analyzed appropriately for the newborn metabolic disorders that they're screening for. And so a less than 2% unsat rate will earn a hospital 3 points. Between 2 and 3 will earn a hospital 2 points, and then a 3% rate, 1 point. Anything over 3% would receive no points for that hospital. Are there any questions related to any of that? I'm just looking